Any trial, whether it is trying to answer a question about what type of surgery a surgeon should do, or how best to look after people who live in care homes, normally include 5 key stages: information and consent, baseline characteristics, randomisation, treatment, and finally, data collection and results. Let's think about the example of finding out whether a new medicine is better than the current medicine and think these stages through. First up is information and consent. First, we have to ask the group of people who our question is about to take part. So, at the start, everyone is given information about what will happen if they take part in the clinical trial. They then take time to consider whether they want to take part, and this is called consent. Because we do not know whether the new medicine is safe for everyone, there are a set of rules about who can take part, and these are called eligibility criteria. Next up is baseline characteristics. Before we can give any medicine, we need some information about the types of people taking part, and we call these baseline characteristics. This makes sure that anything we think could affect the answer to our question we are asking is collected. We also use these answers to summarise everyone who takes part in our clinical trial and know if they are like the wider group of people with the disease or condition that we're asking our question about. The third step is randomisation. So that the answers to our question aren't affected by things like people choosing to have one treatment than the other, no one chooses what medicine they get. This is done using something called randomisation. Randomisation uses a computer to pick a medicine for each patient. We use this so our groups of people having the new medicine and the current medicine are balanced for things that might affect the answer to our question, like age and gender. The fourth stage is the treatment stage. Once someone has been randomised, they receive their medicine. We call the new medicine the intervention treatment and the current medicine the control treatment. We carefully check on everyone whilst they are having their medicine to make sure that they are taking it and are safe. Last up is data collection and results. So that we can answer the question, we collect information on the people in the clinical trial whilst they are having their medicine. Once we have collected all our information, we compare it between the two groups of people having the new medicine and the current medicine. This tells us whether the intervention is better or worse than the control and allows us to answer the question that we started off with.